Good afternoon and thank you for joining us. My name is Tina Tebow and I'm the Director of Media Relations for the Province of Nova Scotia, and I will be your moderator for this afternoon's news conference. Again, same rules applies as always. We are now live streaming. We'll take questions from the room and then we'll go to the phones. Go ahead, Premier.
Thank you, Tina. Today, as we announced, we have two more presumptive cases here in the province of COVID-19, taking the total to 5. I will now ask Dr. Strang to elaborate.
Thank you, Premier. Good afternoon, everybody. So the two cases today, there are a couple in their 50s, live in the HRM area. They were in contact with people who have traveled to Nova Scotia from outside of the country. The couple themselves have not traveled outside of the country. We're in the process of doing active follow-up with those exposures, trying to understand exactly in more detail who they were exposed to, and were there any other Nova Scotians who may have been exposed at the same time. So that is work that is underway right now by local public health. Both remain well and are at home.
Thank you, Dr. Strang. And just a reminder, first of all, let me just say thank you to all Nova Scotians who've continued to work diligently to ensure the health and safety of their community. But I want to remind you that anyone who has traveled outside of Canada who enters into Nova Scotia to come home must self-isolate for 14 days when they return to our province, with no exceptions. We now have our own inspectors at the airport who are greeting arriving domestic and international flights to remind everyone to self-isolate, as well as if you feel sick, call 811. We've also continued to remind you that there will be no visitors allowed to our long-term care facilities until further notice. And also, yesterday we announced that our daycares would be closing effective today. I want to assure parents, first of all, that their spot in those child care facilities will be protected. And I want to assure all of those regulated child care businesses that the government support will continue to be there as we work our way through dealing with COVID-19. There has been a challenge or questions around those of you who are sending your children to neighbors or friends. That is still allowed. We encourage you to make sure that you are limiting the number of children that are involved in that, and there's a number of 5 that allows you to have an unregulated environment. We would encourage you to do that, but you as parents have the right to send your children to where you wish. I would also strongly encourage you that it not be your children's grandparents providing them that support. We have seen that it is the elderly and those with other underlying health occurrences that this has had a major impact on. I also want to say to all of you, this is having a tremendous impact, not only in our economy, but on the national economy. You heard the Prime Minister today talk about a $1 billion investment that will be made by the national government in the economy of Canada. The Minister of Business and the Minister of Finance are being joined by others on a rapid response to identify what that will mean for Nova Scotia and the investments that we can make to ensure that we work with small business owners and those that work for them. We know this is having an impact on credit, the ability for them to secure credit. We will be providing some support in future days around initiatives that we can help with. At the same time, we want to make sure that those who are employed in those small businesses continue to be employed. We're working with the national government to see if there's ways to ensure that whether you don't have enough hours for unemployment insurance, can that be adjusted? Or if you're self-employed and normally you don't qualify for unemployment insurance, we want the national government to waive that provision as we go through and work our way through COVID-19 and as we try to mitigate the impact on families and communities across the province. And again, I want to say thank you to so many Nova Scotians and communities who are caring for one another. I'm sure all of you are following it online. It's extraordinary the things that people are doing, from restaurants and wellness markets who have now allowing people to order online and they're delivering directly to people's doorsteps. You're seeing communities with making social groups dedicated to helping swap items with neighbors, particularly with small children, but not just the small children, but neighbors looking after neighbors. Nova Scotians who are stepping up for the most vulnerable in our communities, who are offering to do grocery shopping, to help pick up stuff. If you're going out, you see that online. And some are even leaving letters on doorsteps of people in our community that they know aren't involved in social media, so that they know somebody is caring and thinking about them. That is the way our province continued and has always responded. And I want to tell you, in this time, it's probably more critical than ever that we continue to reassure our neighbors that no matter what is happening, we're still going to continue to look out for them. And some are out buying gift cards at small businesses to make sure they put cash in that small business and a gift card that they'll use at a later date, because they want to make sure that people know what's happening to them. So my advice to everyone, and my ask to everyone, is to continue to look out and support one another as we work our way through this process. And as Dr. Strang will tell you, we need to continue to do proper hygiene practices. And that will go a long way to ensuring that we flatten the curve on this virus as it comes into Nova Scotia. So with that, we'll open it up to the floor to answer any questions.
Dr. Strang, with the latest cases in terms of the timeline, I'm wondering the people that the patients came in contact with, should they have been self-isolating before they were in contact with these people?
So we're working through the details. It looks like that the exposures were in the last week to 2 weeks before some of these newest rules were put in place. So it doesn't look like that, but again, we're just starting to investigate this, and well, that's one of the things we'd have to look at. Were appropriate rules around travelers being followed or not?
But nonetheless, it would be an illustration of the importance of self-isolating if you've been traveling, obviously.
Absolutely, and also how people coming into the provinces, that is how we're getting this introduced here, and all the things we're doing, including self-isolation, the personal protective measures, the strong public health measures we're doing to encourage social and require social distancing. As the Premier said, we're at the beginning of this. I'm not surprised at all that we announced 3 cases yesterday, 2 today. We will see more, and we will at some point see ones which are spread within the community. But the collective impact of what we're doing will slow down that spread, bring the peak of when we get there much lower than we would otherwise have. It's all about keeping as many Nova Scotians healthy as possible, helping preserve our healthcare system as much as we can, so all of us have access to that, whether it's for COVID-19 or other health issues. We need our health system to be there.
When do you expect to see those cases confirmed?
So we've had one back already. That's now that one of the ones we announced yesterday is now a confirmed case. So it's probably within the 24 to 48 hour period that we announce a presumptive case. We'll get them come back as confirmed. We are setting up now through our website a list where we're going to every day we'll be updating the numbers of people that have been tested, the number of negatives, number of positives, presumptive positives, and now we're going to be reporting on the number of confirmed positives.
Would you invoke to the individuals who infected this couple? Where are they now?
That's all part of. We know that they were at events where there were people from out of the country. So it's all part of what we're working out to understand with those event organizers to get actually individual information on people and working with them and who was there from Nova Scotia and the timelines of when that happened. Could people still be at risk of coming down ill now, and how we're going to communicate that? We need a certain amount of information before we take those specific actions. We're actively working to get that information.
Might you invoke the powers of the Health Protection Act around quarantine?
We are already, a lot of what we're doing is under the powers under the Health Protection Act.
And the same question about the Emergency Measures Act about price gouging.
Do you want me? I mean, we've talked about what we're doing now is around the Health Protection Act. We have some sequential pieces where we could all go to a public health emergency, and also ultimately the Emergency Measures Act. We're using those powers in an incremental way.
I hear you saying we're suggesting that people self-quarantine for 14 days, or you must, but I'm not hearing you say it's the law that you have to.
Well, it is now, and it's a verbal order as of yesterday, and we have legal people writing the written order that has to be done within 72 hours. But it's a requirement. We're saying people that they need to come back. When they come back from out of the country, they need to self-isolate.
Are you
I
saying,
do want to say that Nova Scotians have been responding favorably to that. The response that we received today with our staff at the airport, people know that coming into Nova Scotia. This was a reminder from our staff, and they recognize that. And kudos to them that their loved ones who are still in the province are making sure they self-isolate for 14 days.
Anecdotally, some people are ignoring it.
Anecdotally, but we've seen that, and we've said to those communities, if someone knows they are, then they need to call public health.
What will happen to people who ignore it?
So we have the ability when if there's an order under the Health Protection Act, there is the ability that somebody, if we are aware that they're actively non-compliant, then we can actually then take them really a court order that you must comply with the order under the Health Protection Act. But we really believe that the vast majority of people are going to do the right thing here. And we would also encourage, if Nova Scotians are aware of somebody who's not, take on the responsibility to have a polite conversation with that individual to help them understand why it's important that we can't think about ourselves, we have to think about our community and what we're doing to help protect everybody else in our community. Take on that responsibility and have that conversation with somebody.
Have there been further conversations about interprovincial travel since yesterday?
There is, I'm sure you saw the Prime Minister a few minutes ago when it talked about our international borders. So far, there hasn't been at our level around interprovincial travel. I know the Prime Minister, as he spoke today, that has been something I'm sure they'll be thinking about in the coming days. But at this point, at my level, there hasn't been. I don't know whether, Dr. Strang, you guys have had at yours.
No, we haven't. It's certainly something that we're keeping an eye on, and where there are indications of community spread. But at this point, there's nothing to suggest that they're closing down borders within Canada. But that's not. But we're all realistic of where we might be, and certainly that's not off the table.
What would your advice be generally, though, despite the fact that hasn't been? I mean, if you're considering going somewhere else where they may have more cases than, say, here, is that a wise thing to do?
Well, what I said yesterday is now is the time for us to be thinking about how we slow down our lives, stay close to home, if at all possible, even within the province. Because part of when we travel, we're likely to be more in contact with each other. So it's about that keeping ourselves close to home, minimizing our contact with others, especially those who are most vulnerable, and your travel plans, that you have to factor that into any travel plans.
And I think the fact that we now have our international flights are coming through 4 airports: Toronto, Montreal, Calgary, and Vancouver, and most of those other people getting to Nova Scotia will be on domestic flights. I think it's important for us to recognize that if any of them are infected, they'll be coming on another flight within inside of Canada. It's why we've put our inspectors at both the domestic and international flights, because we want Nova Scotians to know who may have entered at another point inside of the country from either the U.S. or a European destination, that you have to self-isolate. Even though Border Security's dealt with them in those other airports, it's critical that they know that they have to self-isolate. And I think it's important for Nova Scotians and Atlantic Canadians to recognize, for people to get home from either the U.S. or predominantly from Europe. There is still some direct U.S. flights. They're coming from other parts of Canada.
Other provinces, I think it was BC, just said they're now limiting groups to 50 people. I know you had suggested there be a limit of 150 people. Are we revisiting that at all at this point? Are you looking at closing down any kind of establishments like malls? The stores are still crazy. What do you say to that end?
I'll say that idea of 50 came out yesterday from CDC Atlanta in the U.S. We have an FPT call tomorrow at my level, my colleagues, and it's one that we're certainly going to be on the agenda. Federal, provincial, territorial. At my level, all the chief medical officers of health working together. I wasn't aware that BC had gone already, but it's certainly something we're looking at, because we're some provinces are 250, we're 150. Maybe we all need together to shrink down to 50. We'll be talking about that.
I think it's important, though, that all of these measures are being reviewed daily as these things change, and that number may shift, as will the potential tightening down of what's allowed to be open and what's not.
That was the next question. Could we potentially see some businesses be forced to close down, like restaurants or malls, things like that?
I would say to you that at this point, we'll do whatever we have to do to protect public health. And if it's in the best interest of public health, we will be taking the authority that's given to us as me as the Premier and as population health to do whatever we have to protect the citizens of this province.
Yesterday, you gave a number of 240 ventilators plus 140 more on order. Is that enough?
Through the health advice we're receiving, yes, we believe it is. There's also every operating room across the province would also have a ventilator in as well as part of that, over and above that. So what the number one thing is that we need to make sure that as this virus comes into that, we have put in the appropriate protocols to prevent the spread. And recognizing that less than 20% of the people so far infected by this disease would actually find themselves actually requiring medical care in a hospital. Many of them are treated at home.
Understood. But have you gamed this out, like a worst case scenario?
Yeah, the health authority would have gamed it out, and we're working towards it, and that's what we're working towards is the worst case scenario. It's why there's additional ventilators that would come in, and we believe that would come.
Some look at what that looks like, with some discussion of that?
Well, it's pretty difficult for us to be able to do that. We look through different stages. We're now hardening our healthcare system to ensure that we've built in the ability to be able to respond to the needs of citizens who are impacted by this. We'll have more to say with our partners at the Health Authority and the IWK in the coming days of steps that we've taken internally, or they've taken internally, to make sure that the system is ready if needed. But I go back to what I've always said, and I think Dr. Strang has said in the beginning, it's absolutely critical. If we get Nova Scotians to self-isolate themselves, we've made a major step in protecting Nova Scotians from this virus. I say this, it's tough for me to say this, but if your grandparents are coming home from the United States after being there for a number of months, don't go see them for 2 weeks. If your parents are coming home, don't go see them for 2 weeks. If you've been away, do not go back into your family environment. Isolate yourself from your loved ones. It's the least you can do, and you protect not only them, you protect your neighbors and communities. And this is the single biggest thing we can do to protect our system. Because if we end up getting more and more of the virus going into either a long-term care facility or one of our healthcare facilities, it's much more difficult to control it. It's quite frankly, literally, 80% of this is in the hands of each of us. By cleaning our hands and by doing the proper protocol of self-isolating ourselves. That's the gift we have about this virus, in my view, that every one of us can take the appropriate steps to protect the people we love and to protect the people who are around us, our fellow Nova Scotians, by just doing these simple, unselfish steps of protecting our communities.
We'll go to the phone lines now. We'll take 3 questions from the phone and we'll come back to the room. Go ahead on the phone if you have a, go ahead.
Yes, exactly. Could you please clarify exactly how much financial support is available for child care centers, and what percentage of wage and operating costs will that support cover for each center?
No, what is available currently, every one of the centers that are regulated would have support from the government. So that bursary that would have gone to those centers will still be protected, as well as the portion that parents are currently paying today that they will obviously won't be paying because they won't be in the facility. We will be covering as a government to make sure that we keep that operation whole, which means they will be able to pay their employees as we work our way through the period of time that they'll be closed.
Do you have a follow-up question? And again, please identify what outlet you're with, please.
All
right.
Sorry, I just had a follow-up to that question. I'm Rebecca Brown with All Nova Scotia.
Great. Thanks, Rebecca. Go ahead.
So what is the total spend then in government dollars?
I don't have the number right in front of me. We can get that for you. That would be something that goes through the Department of Early Childhood and Education, but each one would be different. So each bursary is different depending on the site, the number of kids, all of those types of things. But we can get that number for you.
We'll go back to the phone lines for 2 more questions. Do you have a question from the phones?
Drake Wilders with the Reporter.
Go ahead.
You just mentioned that we need to start isolating ourselves from our loved ones. But what do you have to say to the province's university students, many of whom are teenagers and alone for the first time from their families, who may feel a little hopeless during this time?
Well, I was on a call actually this morning with our university presidents and the president of our college system. The university population has been doing a tremendous job of supporting one another, ensuring that first of all, those students that they have in residence that live in Nova Scotia, they're repatriating many of them back to their own home communities. And then providing supports around how to supporting the university kids that are from other countries. There's been some issues associated with, when the year ends, some of them may not be able to get home. So we're working with our university partners. Minister Kasoulis is working hard, along with Deputy Minister Montgomery and all of our presidents, to ensure that we provide options for those students in the coming weeks.
Drake, did you have a follow-up question?
No, I didn't. Thank you.
Great. We'll take one more question from the phone lines.
Steve Goodwin from the Advocate in Pictou.
Go ahead, Steve.
I'm noticing the completed tests, 671 negative results out of the 676. I'm wondering how changeable that is day to day.
So we know over the weekend we were running around 200 tests a day. So we can expect that volume, and they're all going to turn into negatives or a few positives. So we're seeing a lot of volume through our labs, and as I said, upwards of 200 tests a day.
Steve, did you have a follow-up question?
I'm good, thank you.
Great. We'll come back to Shayna. Go ahead, Shayna.
Premier, given the rush to get ventilators here now, should we have been stockpiling them after SARS?
So there were some here after SARS, as the doctor would be able to tell you. We also have within our system a certain number of requirements that were there. There's been some added. But these additional ones went through a national procurement process after the procedure had been taken within inside of our system to require the number that we thought we would need if the worst case scenario. But I think, Doctor, you might be able to respond to that.
Yeah, I think you got to recognize that they're a piece of equipment that the technology changed over time. So we did increase the number of ventilators we had during H1N1, but that was 11 years ago, and the technology has significantly changed on those. One of the things we talked this morning with the health authority was about having the biomedical technicians look at those ones that, even though we wouldn't use them on a normal basis because they're outdated, maybe they can still play a role in an emergency event like this. So, but they're expensive, and also they outdate. So, just creating a big stockpile of ventilators, thinking that whatever time in the future you might have them, may not be the wisest thing. But when we get into an event like this, rapidly finding ways that we deploy what we have in creative ways, as well as we're participating in a national procurement program to get more.
We'll take 2 more questions. Go ahead, Keith.
Dr. Strang, I wonder if I could revisit an issue that was brought up earlier about the idea that is the message getting through to people about self-isolating? Because I noticed a theme today in just about all the briefings that I listened into. PEI spent a lot of time talking about that. I know New Brunswick talked about it again. It seems like there's a coordinated effort yet again to get people to realize that they have to self-isolate. Is that an inaccurate reading of what I'm hearing?
So, I mean, it's coordinated from the extent that it's at the tables that I'm at, we all agree that self-isolation, both the combination of the personal protective measures and all the public health measures which help separate people, the social distancing and isolation is critical to that. Those are the tools we have in our toolbox right now. We don't have a vaccine. We don't have treatment. So everybody's pushing those. And the reason you hear us emphasizing it is because, as myself and the Premier have said, again, in previous conferences and today, they're critically important. If we adhere to these, we can actually bring down the impact from 30 to 50% of the transmission of this the virus. But we'll only get that if everybody is doing them, it's all working together. And that will have a huge impact on the number of people who get sick and the stresses that are put on our healthcare system. So we need to say it over and over again to reinforce the critical importance of these points. We're not saying it because we don't believe people are hearing it. Everything, a lot of what we're hearing is a lot of people are hearing it, but it's so important that we need to keep repeating it. Just like people are probably tired of me saying wash your hands, but I'm going to keep saying it, and I'm going to keep saying self-isolate.
We'll take one more question. Go ahead, Shayna.
Just to clarify, did I understand you right earlier, Dr. Strang, when you said that you believe that this couple might have got COVID-19 at an event?
Well, they were at some events where there were people who had come from outside of the country into those events. We're in the process of exploring exactly what those events were, where they were, who specifically was at those events. I can't give you any more detail today because it's under active investigation and follow-up. But that's where we feel that their likely exposure was, because they themselves have not traveled outside of the province, but there's very logical places where they were likely exposed to people who could have been infectious because of them coming from outside of Canada.
So did you say if those events, you believe the events happened in Nova Scotia?
We know that these people did not travel, so it would have had to be, and there's several places that we're working with them to get more details. This will unfold over time as we get some more of those details, and we can be more specific. One of the things we're focusing on is very directly is that are there other Nova Scotians who may have been put at risk? We need to understand those events in much more detail than we have in front of us today. It's kind of like a police investigation. We got a lot of detective work. It's called shoe leather epidemiology. People getting on the ground, talking to people, getting a lot of information to put the case, all the pieces together.
Last question.
We now have COVID in the community. Are you advising people with flu-like symptoms who haven't traveled to call?
So I'm not saying we have COVID in the community. What I'm saying is that there was an event within Nova Scotia that people from outside Nova Scotia, it seemed to me that was a likely exposure. It would be premature to say that has now resulted in spread within the community. They're two different things. Exposure from people outside in Nova Scotia versus Nova Scotians spreading amongst ourselves within the community.
So even if you haven't traveled, the advice remains the same. If you haven't traveled, you don't go through that testing process?
No, because we don't have any evidence of community spread at all in Nova Scotia. Again, I have to emphasize, just because some Nova Scotians were at an event that was an international event that they may have been exposed, that is different than saying in a community there are now Nova Scotians, it's been spread amongst Nova Scotians.
So one of the things we've noticed that if someone has gone from a particular family and they come home and haven't self-isolated from their family and come down with COVID-19, then obviously your family is at risk of contracting that from you as the individual going out. I do just want to say in the end, I want to thank all of our healthcare workers across the province, in our hospitals and communities, in our long-term care facilities who've been working diligently to ensure that their system is ready, if required, to provide support and care, which they do every day for citizens in our province, but obviously working under the kind of stress and pressure that COVID-19 has provided to healthcare workers across the country. Ours have stepped up and done a tremendous job, and I want to say thank you to them. And I also want to recognize the many Nova Scotians who reached out to healthcare providers, whether it's nurses, doctors, people working, technicians working in the hospitals, to provide them support and care and child care at this critical time. It's a real demonstration of how much we appreciate what they do, and it's also an acknowledgement of the stress and pressure they're under when they're having to deal with this. So I just want to end with a big thank you to them.
Thank you very much for joining us today.
Sorry, final clarification. You did say one confirmed case for presumptive now, correct?
Yes, because one of the ones we announced yesterday has come back as a confirmed